Are you aware of how to help someone having a stroke? Do you know about the risk factors and how to prevent yourself from experiencing a stroke? Knowing how to treat a stroke in time can literally save a life, even your own. Here to explain more about the types of strokes, how to help someone, and where to seek treatment is Margot Kerman and Dr. Kristen Baker with Baptist Healthcare. Thank you both so much for coming on today.
Thanks for having us.
To get started, share a little about your experience at Baptist.
Yes, I'm a board-certified neurologist, and I've been in practice for about 10 years. And at Baptist, I work as a neurohospitalist, which means I treat patients in the hospital with neurological disorders.
Okay.
And I recently moved to Pensacola around the end of July and took the job as a stroke coordinator at Baptist Healthcare. Before that, I worked in San Diego and Cincinnati as a nurse in the emergency department and also interventional radiology.
Okay. Now, we hear the word stroke a lot, we see the word stroke a lot, but Dr. Baker, I'm curious, what are the different types of strokes?
So stroke at its heart is a disruption of blood supply to the brain. That disruption of blood supply can occur as a blockage, which causes an ischemic type of stroke, or rupture of blood into the brain, which causes a hemorrhagic type of stroke.
Okay. Now, what are the signs and symptoms of those various types of strokes, and what should someone do if they start to experience them?
So we like to teach the mnemonic of be fast.
Okay.
And by that, the B stands for balance, so sudden loss of balance or gait disorder. The E stands for eyes, and that means a sudden loss of vision or blurry vision, double vision. F stands for face, and often you can see a face drooping, like one side of the face drooping down. A stands for arm, which would be sudden weakness of the arm, and we also include leg in that, so often sudden weakness along one side of the body. The S is for speech, which is sudden disruption of speech or slurred speech. And the T is time, and that means when you see these symptoms, notice them in someone else or yourself, the most important thing is to seek care immediately, to call 911 and get to the nearest emergency room.
Okay. Now, what are the risk factors that maybe lead up to that stroke?
So we think of risk factors as in modifiable and non-modifiable. And so the non-modifiable risk factors would be age and family history. Modifiable risk factors are things such as high blood pressure, diabetes, high cholesterol, smoking or drug abuse, and cardiac disease.
Okay. And what proactive measures can people take to mitigate that risk?
Well, obviously not smoking or
Right.
using drugs, and then also having regular primary care follow-up to make sure that these other things are in control.
You mentioned, just general heart health and stuff like that. So it sounds like just a healthy diet, a healthy exercise regimen,
Yes.
those activities of daily living that doctors recommend in the first place are huge when it comes to avoiding a stroke. Is that right?
Exactly.
Fantastic.
Exactly.
Now, I know the American Heart Association announced new guidelines for stroke care. Tell us about those, Margot.
Sure, like you said, American Heart just came out with new guidelines about treating ischemic stroke. We're most excited about the update of the expansion of the treatment window for clot retrieval. And for those of you who don't know what clot retrieval is, it's an endovascular procedure that allows physicians to use a device called a stent retriever to remove a clot from a blood vessel in the brain.
Okay.
Previously, in order to qualify for this procedure, there's a window of 6 hours that the patient had to seek treatment.
Oh, wow.
The new guidelines have actually expanded that window up to 24 hours for eligible patients. We're obviously very excited about this because it gives us the opportunity to potentially treat more stroke patients. And Baptist Hospital is actually one of the only facilities in this area that does clot retrievals 24/7. I do want everyone to realize, though, that expansion of that treatment window is only for clot retrieval and not TPA. Okay. So TPA, which is the medication we can give for ischemic stroke, is still 4.5 hours. So we want to make sure that people are still getting to the hospital. We need to remember that stroke's still an emergency. If you have signs and symptoms of stroke, you need to call 911 immediately.
And that 4.5, that 6, that 24-hour window you're talking about, that is from the stroke. That is
That's
from when the stroke hits.
The onset of symptoms.
That is crazy, because I know a lot of people, maybe they're starting to experience some of those symptoms, and they say, oh, it's it's not that big a deal, you know, and then it worsens and they just don't want to go. But really, I mean, time is incredibly of
free.
the essence.
Yes.
Even though the period has essentially quadrupled for that period that you were talking about.
But the sooner patients seek treatment,
Sure.
the better their outcomes is. So even though the window is bigger, you definitely want to seek treatment immediately.
So that Be Fast acronym really rings true.
Absolutely.
Definitely. So tell us about the stroke resources that are available here locally at Baptist.
So Baptist Healthcare has 3 hospitals. We have Jay, Gulf Breeze, and Baptist. Jay is actually capable of starting TPA for the patients, and then they get transferred to Baptist Hospital. Gulf Breeze is a primary stroke center. They're able to give TPA and then manage their stroke patients after that.
Okay.
And Baptist Hospital not only gives TPA, but like I said before, we're able to do clot retrievals and then manage those patients as well.
And if someone wants more information either about strokes in general or what resources are available specifically at Baptist, where would they go?
Sure. So Baptist Healthcare has a website that has lots of information about stroke, different resources that they can refer to. And in addition, there's always the American Heart website, which gives a ton of information on stroke.
Definitely. Thank you both so much for coming on.
Thank you for
Awesome.
having us.
Thank you for having us.